once you get the testing, what's your typical protocol? What do you do in order to be able to, do you just kind of take these things and fix the imbalances, or what do you do?
That's the
What's step
big
two?
part. But let's say this. So in an ideal world, people would take their lab tests because you want to see where you are at baseline. And then you do something called a 21-day functional medicine detox. That's just a foundation. What that involves.
So step 2 is going to be a detox. Yeah.
That's right.
Of some sort.
It's going to be a
You want to be
subtractive process.
purging the stuff out of your system.
The best way to think of it is you've got a cup that's full and you're pouring more water into it. It's not going to take as well. So empty that cup first so that every nutritional supplement, every food is absorbed that much easier, that much better.
Got it. So what are all the ways to detox?
So we do what's called a functional medicine detox. And that's because we know through science how the liver works. It uses B vitamins and zinc and other nutrients to essentially liberate these fat soluble toxins. So think about the glyphosate that we talked about, the benzenes, whatever it is. The biggest, let's say, hit on detox, like, well, your liver is always detoxing, so you don't need to detox. It's true. Your liver and kidneys are always detoxing. So is your skin. And so what we want to do, though, is support that to a greater level. The hardest time the liver really ever has is when you are on antibiotics or you're losing weight. Antibiotics kills off a lot of bacteria. All that needs to be filtered through the liver. And that's why people can have what's called a Herxheimer reaction, headaches, joint pain, flu-like symptoms. But the same thing can happen when people maybe do a water fast or they lose weight, because your fat is called your adipose tissue, and it stores these heavy metals, hormones, all sorts of different things. We work with Olympians, professional athletes, whoever it might be. People will often hear, oh, this person tested positive for this small picogram amount of this drug. Well, they may have not taken anything for 5 or 10 years, but some of that was stored in their adipose tissue. And now when they've dropped 20, 30 pounds, it's actually in their bloodstream. What we do for the liver is give it the nutrients it needs, the vitamins and minerals, plus what it's typically missing to turn it into a water-soluble toxin, which is called the sulfur-based amino acids. So that is the methionine, the taurine, the N-acetylcysteine, the glutathione, which is now becoming more popular.
Yep.
That then enables you to get rid of it through a bowel movement, through urine, through sweat in the skin, or even huff it off through the lungs. So that's what we're trying to do. But it's not just that. It's 2.5 days of liquid-based fasting, which is easier than a water fast because you're getting the micronutrients that you need. And then it teaches you meal timing, intermittent fasting, anti-inflammatory diet plan, adding in a little bit more plant-based food, allowing the body a time of rest. That's really what you're trying to do.
If you're into network marketing, entrepreneurship, or personal development, hit subscribe for daily content. Don't miss out. We've got you covered every single day. Let's grow together.